Good afternoon, everyone, and thank you for joining us for this important conversation about equity in action, envisioning a post-COVID Arkansas. We're excited to have you here, and we appreciate your time. I am Dr. Alicia Smith, the Executive Director of the Ideals Institute. We are grateful that the Equity in Action Forum is co-sponsored by the Winthrop Rockefeller Foundation. The Winthrop Rockefeller Foundation believes that every Arkansan deserves a chance to thrive and prosper, and they exist to relentlessly pursue economic, educational, social, ethnic, and racial equity for all Arkansans. And they believe that building pathways to opportunity requires broad systemic change. This comprehensive approach may take longer to prove impact, but they believe that it has a great chance to make an impact that is sustainable. They look for levers that offer the greatest promise to increase prosperity from one generation to the next. Thank you, Dr. Sharice West Scantleberry and the Winthrop Rockefeller Foundation for your support. The Ideals Institute is a new innovation out of the Office for Diversity and Inclusion at the University of Arkansas. We are a training, consultancy, and research institute dedicated to creating diverse, equitable, and inclusive workplaces and communities. We provide services and supports in training and education, research, outreach, and leadership consulting. We work with systems leaders and employers representing organizations of all sizes, sectors, and industries, including for-profit corporations, nonprofits, educational institutions, as well as municipal governments and public agencies. At Ideals, we are serious about transformational change, and to have transformational change, we believe that you must have engagement at all of these three levels: people, processes, and power. This is our P3 model of systems change, where we engage people as they analyze, learn, and reimagine an inclusive environment, examine and assess policies, practices, and processes against an organization's espoused values, and equip leaders in equitable decision-making strategies to challenge power structures that are inequitable. And what we really want you to know is that serious change requires systems change. This forum is part of our offerings to increase awareness and engage people in a discussion about equity in the hopes that we can enhance our state, workplaces, and communities. We'd love to partner with you to harness the power of diversity, equity, and inclusion. After the introduction of our panel, I'll just give you an idea of how we're going to work today's panel, our panel discussion. Our format is, after our introductions, you'll get the opportunity to hear from each of our esteemed panelists for about 5 minutes, who will provide their perspectives of the issues surrounding equity in Arkansas, especially as they relate to the COVID-19 pandemic. Then I will pose some prepared questions to the panelists, and then we'll take your questions from the audience. So again, please post your questions in the chat box that'll be managed by the Ideals team. And of course, due to time limitations, we may not be able to get to all of the questions, but we'll definitely do our best to keep this conversation going. Before we ask our panelists to dive deeper into equity in the face of COVID-19, let's look at the statistics on how many Arkansans have been affected by this pandemic. The coronavirus disease continues to spread around the world with over 4.8 million cases and 328,471 deaths as of May 20th, 2020. In the United States, the number of infections has risen dramatically since the first week of March, and the U.S. now has more confirmed cases and deaths than any other country worldwide. All 50 states have been affected, but New York has the highest number of deaths and reported more cases than any single country outside of the United States. The United States is now reporting widespread community transmission, which means that the human infection is spreading without a chain of transmission, and we don't know how patients or when patients or where patients get exposed. Here are the number of positive cases per county. As of yesterday, the number of COVID cases has reached over 5,000, according to the Arkansas Department of Health. From this May 20th breakdown provided by the Arkansas Department of Health, of the 5,000 cases, 535 have been hospitalized, 325 have been nursing home residents, 61.3 are males, 1,899 are between the ages of 25 and 44, and 35% are African American, nearly 50% white, 5% Hispanic, and 2% are Asian or Pacific Islander. Do you notice that African Americans make up 15.7% of the Arkansas population, yet 35% of the people with COVID-19 are African Americans? Arkansas has had 102 deaths due to the coronavirus, and the counties most affected are Pulaski, Jefferson, Lincoln, Crittenden, and Washington. So with businesses opening and the edicts for physical distancing being relaxed, we ask, now what? Well, Brene Brown recently penned, "We will not go back to normal. Normal never was. Our pre-corona existence was not normal, other than we normalized greed, inequity, exhaustion, depletion, extraction, disconnection, confusion, rape, hoarding, hate, and lack. We should not long to return, my friends. We are being given the opportunity to stitch a new garment, one that fits all of humanity and nature." Those sentiments challenge us to create a new normal that is equitable and fair. To do that, we must wrestle with the status quo and examine it closely, not only its intent, but its impact. We're excited to have 4 people who have the opportunity to help us imagine and envision a new garment for Arkansas. Dr. Sharice West Scantlebury is President and CEO of the Winthrop Rockefeller Foundation, a private independent foundation whose mission is to improve the lives of all Arkansans in 3 interrelated areas: economic development, education, and economic, racial, and social justice. Involved in philanthropy for 25 years, Dr. West Scantlebury served as the CEO at the Foundation for Louisiana and as a program associate at the Annie E. Casey Foundation. Her professional career includes nearly 30 years of experience in community development, public policy and advocacy, and public service. In addition to running the Winthrop Rockefeller Foundation, Dr. West Scantlebury is active in a number of nonprofits and philanthropy organizations. She has earned her PhD in public policy at the University of Maryland, Baltimore County, Maryland, as well as a master's in public policy from the University of Michigan, Gerald R. Ford School of Public Policy in Ann Arbor, Michigan. Thank you, Dr. West Scantlebury, for joining us today. Mr. Rich Huddleston became the Executive Director of Arkansas Advocates for Children and Families in July of 2004. Previously, Rich served as the Research and Fiscal Policy Director for AACF for 9 years and was the lead program staff for the State Fiscal Analysis Initiative project. Rich has an extensive background in research and public policy and has worked on a variety of public policy issues affecting children. Rich has a Master's of Public Administration from West Virginia University and a Bachelor's in Political Science from Carroll University. Thanks, Rich, for joining us today. Magali Licoli was born in León, Guanajuato, Mexico. I think I messed that up. Look at Magali, I apologize. She moved to Arkansas in 2004. Her interest in labor organizing led her to become involved with poultry processing workers. She's the co-founder of the IWW chapter in Arkansas with the goal of organizing poultry workers. In 2015, Licoli became the executive director of the Northwest Arkansas Workers Justice Center, and while being director, Magali led the poultry campaign in Arkansas, which gained notoriety around the nation. Throughout her work, she's participated as steering council member of HEAL Food Alliance and the co-chair of the National Steering Council of Interfaith Worker Justice. Her vision to ensure fundamental human rights of poultry workers led her to collaborate with a coalition of Immokalee workers to expand the worker-driven social responsibility model to the poultry industry. She co-founded Venceremos, a worker-based organization in Arkansas whose mission is to ensure the human rights of poultry workers. Thank you, Magali, for joining us today. We also have Dr. Karama Neal, who is a president of Southern Bancorp Community Partners, a nonprofit community development financial institution promoting economic mobility in rural areas in Mississippi through development lending, public policy advocacy, and asset building. Prior to joining SBCP in 2009, Dr. Neal served as the program director and adjunct professor in research ethics at Emory University and worked in bioinformatics. Dr. Neal serves on the boards of the Little Rock branch of the Federal Reserve Bank of St. Louis and the Mary Reynolds Babcock Foundation, and is chair of the Arkansas Access to Justice Commission. Neal graduated from historic Little Rock Central High School, completed a BA in biology at Swarthmore College, an MA in bioethics from Loyola University, Chicago, and her PhD is in genetics from Emory University. She completed the Impact Investing program at the University of Oxford's Said Business School and lives with her family in Little Rock, her hometown. We're excited to have you, Dr. Neal, and all of our panelists. Thank you very, very much. To get us started, we'd like to ask Dr. Neal to give us some information about equity in Arkansas and her perspectives on this situation. Dr. Neal?
So good afternoon, and thanks so much for this invitation and for organizing this event. If you go to the next slide, I want to share a map that was shared with me from the Arkansas Asset Funders Network. Next slide, please. Waiting for that to come up. Next slide. So this map, if you take a look at it, just sort of a quick glance, it looks a lot like many maps that you may have seen. Perhaps a map of county by county poverty rates or food insecurity rates or unbanked rates or maybe even broadband access. It looks a lot like that. Not exactly, but a lot like a lot of the maps we've seen before. I don't think most folks would look at that map and say, oh, that looks like a coronavirus or COVID-19 map. We don't see, as we heard before, New York having the largest number of cases and deaths in the United States. We don't see a big dark area in New York. That's because this map is a COVID-19 Community Vulnerability Index map. This is by the Sergo Foundation, and they've compiled this data. This is CDC data along with data from the census and other sources that looks at how vulnerable communities are to coronavirus. And so this is not just public health impact, but this is also looking at economic impact, educational impact, legal, other kinds of impacts. And what we see when we look in the state of Arkansas, that there are lots of regions of significant vulnerability to coronavirus, broad impacts. Next slide, please. So in my brief, this brief time to start, I just want to emphasize four things. One, as I just said, the COVID public health impact is not always aligned with the COVID economic, educational, and related vulnerabilities, many of which align with existing inequities. The reason that map that I just showed looks so much like other maps we've seen is because those other maps talk about the inequities that are already there. And when we map coronavirus on top of those other inequities show up again. So it's important to note that while we may see public health impact in one place that's very significant and certainly worthy of attention, you may also see other impacts in other places, and those are worthy of attention as well. It's important that the solutions that we use to address both the coronavirus itself and other impacts address short, medium, and long-term concerns and address them in ways that reduce prior inequities. So as a loan fund, for example, we think about ways we can help with the grant-type financing in the short term, maybe flexible loans in the medium term, and how can we build capacity so that organizations, businesses, individuals, families are better off in the long term. Similarly, this is an interesting situation in that there have been disruptions both to the supply side and the demand side. And so the solutions that we think about and we create need to address both supply and demand. And importantly, they need to address areas of the public goods. So, for example, we think about supply businesses and organizations that make things that people want to buy, that supply things. Those have got to be in place. We've got to have food supply. We've got to have logistics pathways, those things in place. And so there are solutions for those types of organizations and businesses. The demand side also has to be in place. If people don't have the resources to purchase things, if they are nervous and the public health impact does not allow them to get out to buy those things, then the demand side of the equation is not there. Of course, everything is not, I believe everything is not solved by markets. And so we have to think also about the public good. So what are the kinds of investments that we need to make as from the public perspective that help reduce inequities? These could be things like broadband service or making sure that people have access to educational and healthcare opportunities wherever they are in our state. And finally, as a CDFI, Community Development Financial Institution, I think it's important to note that our organizations are really well positioned to respond throughout this economic crisis, primarily because we are founded, organizations like ours are founded with a mission. They have a drive already to reduce inequities, and so that is what they're looking for, and so they're well positioned to help continue that work throughout this pandemic. Thank you.
Thank you, Dr. Neal. That was really insightful, and I can't wait for us to dig a little deeper into those topics that you've kind of introduced to us. Thank you. Next, we'll have Rich Huddleston. Rich?
Hi, thanks for having me today. I'm very excited to be here. There's obviously been a lot of media attention during the crisis about how the pandemic has disproportionately impacted people of color. And that's true. People of color have contracted and are dying of the virus at much higher rates. In our state, for example, Black Arkansans make up 17% of the state's population, but have comprised 36% of the confirmed cases, and they're 3.5 times more likely to die of the disease than whites. But sadly, this is no surprise to any of us on the call today, I think. After all, the current crisis did not create existing disparities in health, education, and economic security that people of color have had to face for generations because of historical, structural, economic, and racist policies outside of their control. And in a crisis like this, it's low-income workers, especially people of color, who are going to be disproportionately impacted the most because of the disparities they already face. And if you look at disparities in income and wealth, lack of access to quality health care, and the barriers in the healthcare system that are associated with the underdiagnosis and undertreatment of pre-existing health conditions like heart disease, diabetes, and other chronic illnesses, it means that the health of many people of color was already at risk before the crisis even began. And you combine these health factors with other factors, such as the fact that people of color are more likely to work in essential jobs that require their physical presence in the workplace, and increases their risk of coming into contact with the virus, and two, that they're more likely to live in either densely populated areas or areas of concentrated poverty because of lower incomes and discriminatory housing policies, which also puts them at greater risk. You put all this together, and sadly, it's no surprise that people of color have been disproportionately impacted and have fared far worse, relatively speaking, compared to other groups during the outbreak. But while the current crisis did not create the disparities, of course, did exasperate them. I would highly recommend to folks out there that you read a new article written by one of my colleagues at Arkansas Advocates, Melvin Clayton, which is on our website today, which talks about much of this. But I do think as a society, we have to acknowledge and face up to the fact that these disparities that have existed for generations before the current crisis, and which are the result of historical and structural racism and policy barriers that our society has adopted, and which had made the crisis significantly worse for people of color. A couple of quick other observations. First, it's clear to me that unless there are major changes in public policy at both the state and federal levels, that the health and economic security of people of color and low-income families generally will be at greater risk in the years ahead, even after the current crisis is over. Many of the jobs that low-income workers, especially low-income workers of color, depend on in sectors like the restaurant and hospitality sector and the child care industry simply are not going to be there after the current crisis is over, at least not in the levels that they existed before the crisis. If you look at the economic impact in particular industries like child care, for example, it's going to be devastating. One estimate of the child care industry in Arkansas has over 50% of that industry not coming back, which itself will have economic implications not only for the workers in that industry and their families, but also for the supply and quality of child care that many Arkansas families depend on. This, of course, will have major implications for family incomes. I shudder to think at what the new normal poverty rate is going to be in the coming years. And this increase in poverty in turn will have major impacts on child and family well-being in future years and on their long-term ability to succeed. I think our ability to respond to this as a state, of course, is going to depend upon our political will, but also of the state budget, which I will talk more about later during the Q&A session. The last observation I will make is about education. I'm really concerned about children from low-income families and families of color losing even more ground during the outbreak, which is going to worsen existing gaps in education. Most experts believe, and I agree with them, that because of differences in online access, access to quality teachers, educational resources at home, and the lack of access to summer programs this summer, many of which have been canceled, that our most vulnerable children will have lost even more ground in education during the crisis. And this will increase the gaps that they're going to have to overcome in the future and will have implications for the education of future generations of Arkansas students. And depending on how education in the public schools comes back, these gaps could be made worse in future years. If we let our support for public education slide, including our financial support, more than it already has, and if we don't ensure the things that we know improve educational opportunities and outcomes for our most vulnerable students, strategies like quality early childhood education, out-of-school programs like after-school and summer programs, school-based programs, access to quality teachers, and access to community schools, then I think you could see even in future years these gaps compounded if we don't come back and support public education the way that it really needs to be supported to help low-income students and students of color overcome the gaps. So with that, I will stop there.
Wow, thank you so much, Rich. I mean, you've got a lot of work to do, for sure. Thank you for that. Next, we'll hear from Magali Likoli, who is going to give us some additional perspective and insight. Magali?
Yeah, thank you so much for allowing me to share what we are doing. And so just to begin with, let's remember that the first case of COVID-19 in the U.S. began in January. So it was until March, whenever we were organizing, prior to COVID was a huge issue in our communities. I was organizing workers about the chemical use at the poultry plants. A lot of the workers have already respiratory problems. So whenever the COVID-19 became an issue, a lot of the poultry workers are very vulnerable to COVID-19 because of the pre-existing conditions due to the exposure of non-really good working conditions in these poultry plants. So by March, we began with a petition demanding these companies to provide paid sick leave. Let's remember that the conditions of poultry workers were already bad before COVID-19, so a lot of these workers were used to work while sick because they were punished by missing work. So whenever we began talking with workers. Venceremos is a worker-led organization and actually was co-founded by poultry women workers from different poultry plants in the Northwest Arkansas. So whenever we began talking about the issue of COVID-19, the issue, the lack of paid sick leave was a huge concern for them. Also, we began demanding a hazard pay because right now, working in these processing plants are already a high risk before it was already a very dangerous job. And with the COVID-19, it was already a huge issue. In March, we already had over 4,000 positive cases of COVID-19 across the country in these processing plants. So whenever we began doing this work, the companies were not providing PPE, they were not providing, and still are not providing paid sick leave or a hazard pay. And so right now, then after, by April, I began organizing workers directly for the workers to speak up because the companies kept coming back and having the narrative of that they were doing was to protect workers. But because we are a worker-led organization, a grassroots organization, it was very important to give power support to these workers. And so the workers gather close to 300 petitions that we delivered to these companies demanding hazard pay, sick leave, PPE, because by then they were not even granted that. So it was until late April when these companies began providing the PPE, the right PPE, social distancing measures, and we already had positive cases in this plant. So it's been a huge concern for workers right now that still the company is suppressing the information of how many workers are already sick on those facilities. These companies are refusing to follow the recommendations of the CDC guidelines that says that if a worker test positive of COVID-19, they need to shut down the areas, they need to sanitize the areas, and the companies are not doing that. So right now, the workers are so terrified of going to work every day because they are exposing their health. They are exposing also the health of their families. So it's very important for the companies to start providing paid sick leave, to provide paid quarantine, because if workers are provided that, they can be safe at home and prevent the spread of the COVID-19 in these plants. Right now, there is over 14,000 cases of positive cases of COVID-19 across the country. So what we are doing right now is really to resist for an outbreak in these plants, because we cannot separate what happens to these workers. Workers' health is public health, and anything that happens to these workers is going to hugely impact the communities that we live in right now. So we want the company to be transparent to the cases of COVID-19, to inform the workers that they were exposed, that they paid, they are paid for to quarantine, and that we want the companies to white test the workers, of COVID-19, because it's not enough that the companies check the temperature of workers and they are being sent home, and then after that they are asked to come back the next day if they don't have this symptom anymore. So they are really exposing a lot of workers, and so we want the companies to really do meaningful changes for these workers. Right now, the workers are also experiencing a high speed of work. If before the workers had to process up to 145 chickens per minute, right now the workers have to process even more because the demand is higher. They are essential workers, and yet they are not provided the essential benefits. So we can talk a little bit more of that, and thank you so much for that.
Wow, thank you so much. I can't wait to discuss this more and learn more about the work that you're doing.
Thank you.
Next, we'll have Dr. Cherise West-Scantlebury. Cherise?
Good afternoon, and thank you for having me as part of this discussion. So the Winthrop Rockefeller Foundation, as Alicia said, we exist to relentlessly pursue economic, educational, social, ethnic, and racial equity for all Arkansans. This past March, we released a study, Alice in Arkansas. In Arkansas, 41% of households, approximately 474,000 households, cannot afford basic household essentials that are, basic household essentials that are necessary to make ends meet. ALICE stands for Asset Limited, Income Constrained, Employed. That's Asset Limited, Income Constrained, Employed. ALICE households, they have incomes that is above the poverty line, but still struggle to afford basic household necessities, such as housing, childcare, food, transportation, and healthcare. The reason I keep stressing not being able to afford basic household necessities, and I stress that this is 41% of the households in Arkansas, approximately 474,000 households, is because ALICE existed well before COVID, as my colleagues have already talked about. But COVID has made ALICE visible. We see who they are now. And for us, ALICE workers educate our children, they keep us healthy, they make the quality of life possible, and yet they do not earn enough to support their own families. And they are forced to make tough choices, such as deciding between quality childcare or paying rent, which have long-term consequences not only for ALICE families, but for all of us. Again, these households struggle to afford basic housing, food, childcare, healthcare, and transportation even before COVID existed. Our research shows in ALICE in Arkansas, which you'll find on our website, and I know Alicia plans to send resources once this is over. The research confirms that 7 out of 10 jobs in Arkansas are low-wage jobs, which means many of the jobs in our economy just simply do not pay a family-supporting wage. Our data tells us that ALICE workers keep our economy running, but our economy does not support ALICE workers. ALICE is all genders, all races, all ages. ALICE workers are our friends, our neighbors, our caregivers, veterans, students, and the like. And ALICE is ALICE because education, housing, healthcare, and other economic systems in Arkansas are ineffective and essentially produce ALICE households. Because of COVID, ALICE is no longer invisible and should be at the center of all conversations about the future of Arkansas. The false narrative of hard work and personal responsibility will not fix the broken systems of housing, healthcare, education, and the like. We need to move beyond stereotypes and judgments of our ALICE families. We encourage everyone to go and look at this report to inform programmatic and policy solutions for ALICE households and communities. When I think about a post-COVID Arkansas, it is an Arkansas that recognizes that these essential workers, these ALICE workers, should have affordable housing, affordable childcare, affordable health care, wages that enable these families to thrive and build assets, and excellent working conditions. Thank you.
Great. Thank you so much, Sharice. And to all the panelists, you all have really helped us really frame these issues and think through what needs to be done. And so that the easier part is framing the issue. The more difficult part is really arriving at serious solutions. I think one of the main ways we can do that is by really just even for the benefit of our audience is defining what we mean by equity, right? So I think a lot of the things that we've already talked about kind of show shine some light on equity, but a few of you, could you just tell me what does equity mean to you and how does that play out in the work that you're doing? And since we see Sharice, could you take that first one for us, please?
Not quick on that unmuting button, okay, as I should be. Equity in Arkansas. So we envision an equitable Arkansas in which all Arkansans have jobs that pay a family-supporting wage, a quality education, and a chance to thrive and prosper. What equity means is that all Arkansans deserve fair access and opportunity to gain a quality education and to prosper, regardless of race, gender, geography, ability, or any other characteristic. Equity means that outcomes, positive outcomes, should happen for all Arkansans, regardless of where they come from, who they are, and that's how we define equity. It is an Arkansas in which all Arkansans, regardless of background, geography, sexual orientation, gender, have that ability to get a job that pays a family-supporting wage, a quality education, and a chance to thrive and prosper.
Great, thank you very much. Magali, would you like to weigh in also?
Well,
I think you're still muted. Oh, there we go. We got you.
I think I would like to frame it in a way that why I'm doing the work that I'm doing. When I began working at the community clinic here in Springdale, I began receiving a lot of workers who worked in these processing plants. While they came for another service, they always had a chance to share their stories with me. And those stories really changed my life because when I heard many of these workers already injured for life, many were already disabled for life on their early 40s, 50 years old, unable to go to work anymore or to find other jobs. For me, it was shocking to see my community already injured, already harmed, and nobody wanted to talk about these issues. They are remaining in the shadows because nobody wants to talk bad about these companies such Tyson. And for me, it was like a life-changing event to hear how many of these workers were struggling to have the basic health care. Many of them require specialists because they have long injuries for life. And they were like treated like disposals, like expendables. Once they serve these jobs, then they have to leave because either they couldn't or the company just dismissed them because they were no longer serving the company. So for me, equity means that we really need to talk about these workers. We cannot talk about immigrants without talking about the work that they came to do. I mean, actually, Arkansas, the immigration in Arkansas began because of these companies. Many of them, if you talk a lot of them, they came to work in these processing plants. And yet nobody wants to talk about that because it's a taboo. Nobody wants to address these issues that these communities are facing every day. I myself had to go through a lot of problems in the community because I am perceived as being the militant, the radical, because it's just such a taboo and nobody wants to talk about this. So for me, I agree with Cherise. I mean, that is all of that, but we really need to start talking about these workers. And I think during this pandemic, the issues that they were facing many years before are really now more evident. And we cannot continue working to a better Arkansas because if we don't take care of those issues, we keep perpetuating the cycles of poverty. If we don't talk about that and we don't help these companies accountable for what they're doing to these communities, we are not going to see a systemic change happening in these communities. So, yeah.
Thank you. Thank you. Karama or Rich, would you like to jump in, or are you good with what's already been said? I'll give you an opportunity.
I'll just chime in real quickly. Definitely agree with what my co-panelists have said. And I just want to emphasize, I think it's important to remember that when we do the things that create greater equity for all Arkansans, for all people, we're not dealing with a limited pie. I think sometimes we think that the pie is a certain size, and if we start cutting it up differently, somebody's going to get less and somebody's going to get more. What we're doing is increasing the size of the pie. We're increasing benefits for everyone. I think that's really, really a critical thing to remember. And I just point out there's significant data that talks about organizations and corporations being more efficient, being more productive, being more adaptable, innovative, effective, profitable when they prioritize diversity, equity, and inclusion in their organizations. And that's not the only reason to do that. I would argue that's not even the primary reason to do it, but I do think it's an important thing to consider when we think about how we actually move initiatives around equity forward.
There we go. Thank you. I agree. Rich, would you like to jump in?
Yeah, just one quick thing. I would add that for me, it has two components. One is on the resource and opportunity side of things. And I think when you're talking about helping people of color overcome historical and structural barriers, additional historical and structural barriers that they've had to face that other groups have not had to face. Equity might mean not just making sure they have the same resources and opportunities, but actually going further there. And it may be having some additional targeted policies that do more to help them overcome those barriers. So equity doesn't necessarily mean just the same. When you're talking about equity for folks of color, you could be talking about actually doing more in terms of public policy for them. And then on the outcome side of things, I think it's all too often we fall into the trap of equity is about reducing or eliminating gaps, whether it be education, health, family, economic security. Well, eliminating gaps across groups is great, and we need to do that. But in the end, that's not enough. It also means ensuring that people of color, like all children and families, can succeed and realize their full potential. It's not just about eliminating gaps across groups. Good.
Great. Thank you. I appreciate that. So we've kind of outlined some of the statistics around COVID-19, and we can see the impact certainly in our state and in the world as a whole. And we already know that these statistics really impact your communities. But why is this particular moment in time so important to the work you do? Like, why is this moment such a because as we already mentioned, this is not new. This is not new information. It's been going on a long time. Why this moment? Karama, would you like to take that?
Sure. I think that, we heard from Sharice how, this particular moment in time is really allowing us to see Alice. And I think in addition to seeing Alice, this time is allowing us to see a lot of things. It's allowing us to see how much access to capital is important for small businesses to function. It's allowing us to see issues around education, broadband access, and what that means for businesses to function, what that means for education, what that means for our legal system. We have folks who are having hearings, on Zoom and trying to do that kind of thing on their phone with maybe limited or only phone level broadband access. So I think, as we think about, what we're able to see in this context, and I think also for many of us, it's either oftentimes a very high power time because we're working so much more because we're essential workers, or it's a time where it's not necessarily that you're working more, but you're working differently. And so it's an opportunity to take a different kind of look at priorities and what's important. I think all of that is as we look at what the current situation in Arkansas, it allows us to take a step back, perhaps, and using the information that has become newly important, not newly important, but newly visible, allows us to think about what changes we need to make in ways that, frankly, we should have been doing before, but are more obvious now.
Great. Thank you. Yes. Rich, would you like to jump in also?
Sure. I would just echo what Karama said. I think now is a really unique time in our history because we have this crisis, and we've had all this extra media attention that's really been focused on the idea of all these disparities and how people of color have been disproportionately impacted by the virus, not only health-wise but economically. And I think we have all this new attention on what an essential worker is, and how important they are to, quite frankly, to the nation's economy, and also how important they are in our day-to-day lives. So I think it really presents a unique opportunity there. But I also think that right now, in the months ahead, we're going to have some really tough choices to make. Because if you look at what's happening to local, state, and federal budgets, they've taken a huge hit, and so we're going to have to either reorder our priorities, and hopefully we will do that the right way to really support children and families who are struggling right now. So we're going to have some tough choices to make there, but we're also going to have to decide to what extent are we going to support the public good through public investments. And I think, if anything, what we're seeing now is that the demands on state and federal budgets, because of the economic impact of the virus, families are really struggling right now, and so we have a choice to make right now. We're either going to step up and support them, which again is critical to our economy, or we're not. And so I think for a number of different reasons, now's the time, like Karama said, to really kind of rethink what our priorities are and really rethink what's important to us.
Great, thank you. Magali or Sharice, would you like to jump in at all?
Well, I'm really grateful that we were able to build Venceremos just on time to get onto our work on this issue. I think for many workers, Venceremos is a blessing because we are giving voice to workers. I think right now, we were fighting these issues for years, but right now it's so important to highlight what's really happening because a lot of people are also listening to us. We have a lot of media attention. We've been able to highlight the stories of these workers nationwide. And it's so important to have an organization like Venceremos because we believe that the people who are directly affected have also the solutions to what they want to see. I am not a saver. I always said that. I am a facilitator. I am an organizer. I give resources to workers. But for me, whenever we began seeing all of this issue, it was so important to give voice and power to the workers. So I began organizing workers and giving them resources. I've been able to connect workers from South Dakota, where already there were outbreaks on those plants, and for them to share their stories and learn that what happened to them is happening to them right now, and for them to how to fight that, how to prevent an outbreak in these communities. So I've been able to connect workers with lawyers outside Arkansas because, as I said, for me and for Venceremos, it's so important to the trust of workers. Many workers through these years have learned that they cannot talk about those issues because nobody wants to listen to them. Nobody wants to confront these companies. And many of them believe that everybody sold out to this company. So for me, it's so important that they trust me and that I speak to them directly and be outspoken about the issue without sugarcoating, for the people to be peaceful to what our message is. The message of our people, they are at the risk of death and life, and there is no way to be less. To be less outspoken, And so right now, Venceremos is giving power and voice to these workers. And it's despite all of these crises and despite all of these terrible moments that these workers are facing, it's really beautiful to see that these workers are earning the trust and that they have the power to fight. So every week, whenever we have our weekly meetings over the phone, it's amazing to see the engagement of the workers and to see how they are really trusting Venceremos as the organization that will give them voice, and that we cannot go back to the old times, and that this is the moment to really change the reality, because we want to see a different Arkansas after all of this ends, and hopefully it ends soon.
Thank you. Thank you. Sharice, did you want to add something?
This moment is important because the workers that Magali is talking about, the policies that Rich says that we need to push for, the people that Karama works with at SBCP, this is that time that they are visible and that we know they always had worth, but we didn't always treat them or push that they had worth. This is that moment for us to be creative about solutions. This is that moment for us to raise the voices, to mobilize folks. For us in philanthropy, it is that moment for us to know who's doing what work on behalf of Alice families so that we can learn about that work and figure out ways in which we can be supportive of that work. This is that time that if we let this moment slide, and 6 months, a year, or 5 years from now, there still isn't more affordable housing for the nurses, teachers, healthcare workers, then shame on us. If in 6 months to a year, if there isn't an innovative, creative way in which we provide childcare support to ALICE workers, but even create a more effective childcare system for our state, then again, shame on us. This is that moment in time where we have to get creative. We have to look towards solutions. And 41% of our families are counting on us to do so. And 41% of our families need their voices heard, and they need a platform in which to be heard so that the policies and practices and programs support them and not work against them.
Great, thank you. Absolutely. And while we're on that, someone said never let a good crisis go to waste, right? So this is, as you mentioned, our opportunity, our time to really reassess and think through it. And so I'm going to skip around a little bit and ask, what does a new post-COVID look like? What does it look like in terms of achieving equity for all Arkansans and how we actually take the ideas and put them into really concrete solutions and results for our families here in Arkansas? Anyone can jump in on this one? Magali.
I think, first, I think COVID-19 has shown us how close we are to each other, how connected we are. And I think that we really need to rethink the expectations or the working conditions of these workers and expectations on production. Right now, what we are seeing is that these companies want to keep going the production without caring for the life and health for these workers. So I think this is the time that we need to fight for these workers to start being treated like humans, that the expectations that we have over production and capitalism that keep saying we need to produce more and more and more, we need to rethink that. We need to change that. We need to give them, these workers, back their humanity, because for many years, they've been treated less than the chicken that they produce. For many years, they're being told and been dehumanizing these workers, even in our communities. So I think this is the time to start speaking more about justice and more or less so about charity. Because justice, if we bring justice to these workers, probably we won't need so much of charity, And I think that a lot of people will benefit from the suffer from these workers, and they don't want to speak about that. But this is the time that we think that in order to move forward and in order to succeed as statewide, we really need to think about how we see these workers and these immigrants in our communities, because a lot of that is also racism, a lot white supremacy values that keep telling us that these workers is the only choice is to go into work under these conditions, but that has to change. We as a public have the responsibility to demand these companies to stop treating these workers worse than the animal they produce. We as consumers have the power to tell these companies to stop doing what they're doing to these workers and give the workers their voice back and empower them in such a way that they keep going and keep fighting for a better future. So yeah, that's what I think that we all should do, is to learn to listen to these workers and to fight and standing on side to side with these workers.
Thank you, for sure. Thank you. Rich, would you like to weigh in also in terms of ways how are we going to capitalize on this, and how do we do it? What are some of the answers?
Sure. Well, a couple things. first, I mean, I don't want to get too political today, but I think where we go from here probably depends on the elections. I mean, elections matter. Elections have consequences, and I don't care what political party you're with. I think if the current political party in Washington D.C. Stays in power in the White House, quite frankly, the focus there is not going to be on helping low-income workers and people of color, or even helping small businesses recover, but it's going to be about the president's personal agenda and helping large corporations. So I would just point out to folks that elections matter, they have consequences. And I think going from here, we need to put ourselves in a position to make every vote count this November. Because once we get past this initial crisis, there's a heck of a lot of work that's going to have to be done to help rebuild the economy and help the hundreds of millions of workers and their families recover. And at the very least, there's going to have to be a recognition that that social safety net programs like unemployment insurance, Medicaid, SNAP, and others will have to be strengthened, even if it's just temporarily for the next couple of years beyond what we've already done. Or quite frankly, we're going to see greater gaps and greater inequities. And I think similarly at the state level with regard to the state budget, Arkansas has passed quite frankly a bunch of tax cuts over the past 6 years that are having an impact on the state budget. But I think folks should know that even if the current revenue forecast stay where they are for Arkansas. I mean, we're basically looking at a state budget for this coming fiscal year that's going to be close to what it was 3 years ago. I mean, at a time when the demands on the state budget are going to be even more, because we know we're going to have situations we're going to have to deal with in terms of child welfare and in terms of hunger, in terms of homelessness, in terms of getting folks back on their feet, and housing and things like that. So we're going to have to make some choices at the state level to make sure that we have the resources in the budget to deal with these things. So with that, I'll stop there. Oh, one other quick thing that I would mention. I talked about the elections in November. Folks should know that there's an important measure on the ballot in November. It's called Issue 3. And basically what that issue does, if it were to pass, is that it would make it much tougher to do citizen-initiated ballot measures. So like, for example, the last couple of increases we've gotten passed in the minimum wage has because we've had citizen-initiated ballot measures to increase the minimum wage. And so, so to the extent that we as citizens want to have that power when necessary to bypass the legislature to undertake important policy initiatives like increasing the minimum wage, possibly like education reform, possibly like paid family leave in the future, quite frankly, if Issue 3 passes, it's going to make it so much more difficult to pass those types of things. And so in November, you have a choice to make. Are you going to vote for Issue 3 or not? And if you vote for it, just know that you're going to be taking out of the citizens' hands a progressive tool, to do the things that we know that we need to do to help families, whether it's essential workers, Alice families, whatever you want to call them. Just want to call attention to that in November. Thanks.
Great. Thank you so much for doing that. It's really important for us to be aware of these kind of subtleties and really understand what is happening in our ballots. Sharice, would you like to weigh in or add something to this particular question?
It's already been said. The one thing I would add to it is the narrative that our grocers, our nursing assistants, our teachers and all, that they are to blame for not being able to afford housing, or they are to blame for not being able to get good health care, or our part-time workers who have to pull together several jobs to make ends meet for their family. And you asked, what do we want to see post-COVID? It's all of what Rich and Magali talked about in terms of, ensuring that these families are shored up. But also we need to switch how we think about these families and stereotyping them as not important. And that this moment, once this moment passes, we have to we have to make sure that Arkansas' economy works for all Arkansans, and that's what equity it is. It's not about working for those that are wealthy and not y'all, or those who are educated and not y'all, and those who have money and not y'all. It is about creating an economy in which all of us can thrive and prosper. All of us want to send our kids to college. All of us want to have quality, beautiful homes to live in. All of us want to have access to quality education. And that is where the conversation needs to focus, and to ensure that all of us are able to take advantage of those things. And how do we ensure that public policy is responsive to all of us being able to live and thrive? And just because I'm poor or I make just above the poverty level, I shouldn't have to live in squalor. Or because I work for a poultry plant, I should not have proper equipment to keep myself safe.
Absolutely. Thank you very much. I'd like to transition to some of the questions that our participants have posed, and thank you all so much for participating today. The first question says, currently our state faces teacher shortages and inequities within high-need areas in the state. What kind of existing and or new collaborations with schools and organizations might offer some solutions? I'll give you a second to think about that, and then whoever would like to jump in first, I'll let you take the floor.
One more time. I heard you, but just repeat it again.
Sure. It says currently our state faces teacher shortages and inequities within high need areas in the state. What kind of existing and or new collaborations with schools and organizations might offer some solutions?
I can take a crack at that. I think one of the things that is really started to emerge in recent years is the concept of community schools, which is really much more of a holistic and comprehensive effort to make sure that students get everything they need to succeed. But a big part of that is forming partnerships within the community, between schools, between business, between the nonprofit sector, between colleges and universities and local schools, between groups that provide social services, because to the extent that we can form partnerships, we can take advantage of other resources in the community beyond what the school has to offer to help meet the needs of students. And this is a concept that's slowly starting to gain a lot of traction. I might point to the Ford initiative that Sharice and WRF are doing a great job of supporting. And community schools is a big part of that. Push. And Sharice, I don't know if you want to weigh in any more on community schools, but I would just applaud you all for that, and just mention that's a concept whose time is coming, that we need to push it if we want to help get around some of these teacher shortages in some areas. But I will also say that in addition to that, again, we just need as a society to make public education a priority. And quite frankly, public education has received very small increases of the last several years, even when the economy was pretty good. But if we want to eliminate more of these teacher shortages, then quite frankly, we need to do more to support poorer school districts, especially those in more rural areas down in the Delta. Quite frankly, as a state, we're just not doing enough there in terms of resources.
Thank you. Sharice, did you want to add in, or anyone else? Okay. Thank you. Our next question is, how do we keep actions moving forward and avoid going back to business as it was pre-COVID? What practical suggestions do you have for individuals, communities, businesses, philanthropic organizations and nonprofits, municipalities, and others to take? I'll repeat it again. how do we keep actions moving forward and not go back to business as usual? And what practical suggestions do we have for individuals on up, everybody? What can we do to get involved and get engaged?
This is Karama. So one thing I think that is important for us to think about in this period of time is what have we learned? What have we seen that either is working in a way now that it didn't work before or could work even better based on what it is we're seeing now? And so, some examples I think about is folks who have had, for whatever reason, have had to use more remote kinds of technology. For example, if they're a small business owner, they may recognize that even if now is not the time for them to sell their products broadly because of some of the economic challenges we're facing in our country and in our state and in our country, that, going forward, if they're making something even from home, they may be able to sell that through eBay or through some other kind of system that brings new money into our state, new money into their pockets, opens up their markets in a way that perhaps they hadn't done previously because they didn't have the facility, didn't have the capacity to doing that kind of work by broadband. Think about the ways in which people have been able to work. And, there are, and obviously this isn't true for everybody, but for some folks who have been able to work remotely off-site, that may give them new options for how they work and where they work that they might not have seen before. If they were only looking in their local community, perhaps there was not an option to work there in the field that they were interested in or one they had training in. But maybe now, because they have a little bit more capacity with working remotely, they understand that can be productive, a productive way to work. Maybe their options now expand and they have better options to work in other places. So I think those are just a couple of examples. I think there are many more, but I think really being very intentional and around what it is we have learned, what it is we can learn, and then holding ourselves accountable for how we move forward in those ways. So if those kinds of things are important, like we just talked about, then how are we holding ourselves accountable for better broadband technology? How are we holding ourselves accountable for better policies that support education, that support access to civil legal aid, those kinds of things? So I think there are just a number of those kinds of things that we can learn from now and put to practice later.
That's awesome. Thank you. Anyone else?
Yeah, I would just add to that. Arkansas Advocates, as our name suggests, we're advocates, and so we need more people out there to get involved in advocacy around issues impacting children and families. If there was ever a time in our state where advocacy was important to do what Karama suggests in terms of holding our elected officials accountable for the public policies they're adopting or not adopting that should be adopted, it's now. But quite frankly, to do that, we need more advocates. I like to think that Arkansas Advocates is in our own right is a strong advocacy voice. But quite frankly, it has to be more than just groups like us. It has to be the average citizen in the legislative district of the average legislator who an important issue comes up, whether it's during legislation or not during legislative session, that they're reaching out to their legislator and telling them what's important, what do children and families need, and how can we best support children and families, especially our most vulnerable children and families, to make sure that they have the resources and opportunities they need to thrive and succeed. And so becoming involved in the legislative process, becoming involved in the advocacy process, because one thing I will tell you that legislators will tell you that sometimes all it takes is 5 or 6 calls from constituents in their district to have an impact. It doesn't necessarily take hundreds and thousands of calls. For some of them, if they get 5 or 6 calls, it's like a really big deal. So getting involved in advocacy, getting involved in the legislative process, and again, getting involved in elections.
Great. Thank you very much. Our next question says the people most impacted by COVID are prisoners, 1% of Arkansas population and 1/3 of all COVID cases. How can we address that as a part of our equity outlook for Arkansas? And again, this question relates to prisoners and how they are impacted by COVID and how we can address that in terms of our outlook for Arkansas and what that may mean.
In terms of those who are incarcerated, It's what Rich said. It's about advocacy. It's about building voice, exercising voice, giving a platform in which these folk can be heard, and who works with them and fights with them on their behalf. So much of the narrative is about who deserves and who's worthy, and with this pandemic, changing that narrative and changing how we think about our fellow humans and our fellow people, because these are mothers and fathers and sons and daughters and the like. But how do we get that voice? And that advocacy is important. And if we don't speak up and create the outrage or demand justice for testing and the attention that's being paid to those who are incarcerated, how will that happen? So that's what I would suggest is yes, it's important. Yes, that data comes out. Yes, we know that the incarcerated and those who are in nursing homes and other kind of communities such as those are experiencing COVID at a rapid rate. But until we make sure, similar to what Magali is talking about, until we make sure that their voices are heard and ensure that they're not just heard, but that resources are being put towards supporting them or helping them or getting them healthy, it'll just be, it'll just pass us by. It'll just pass us by. And so getting those stories, the narrative, listening, because that's the other thing that happens is that when people do raise their voice, then they are troublemakers, agitators, they're all things negative versus the advocate that they're trying to be.
You're right. Thank you. Would anyone else like to weigh in on this one? Okay, we'll move on to our next question. COVID has caused huge disruptions in other systems such as food supply chains, healthcare, et cetera. Companies and organizations now must rebuild and have a choice to return to the status quo or build a more resilient future. Again, another question about how we can seize this opportunity and incentivize companies and decision makers to take action. Rich, you already discussed, getting involved in terms of contacting our legislators, and Magali's mentioned petitions and other ways. Magali, did you want to add a few more items?
Well, getting involved in organizations like Venceremos, who are like really in the front lines fighting these issues, supporting us. We really have very few capacity. We are all volunteers. And so getting involved in organizations and call to actions, and also involved in legislation and advocacy work, because right now also there is a lot of risk of, and there has been waivers to companies to increase the line speed. Also, like the government is really protecting these companies and force these companies to remain open despite of the outbreak. So they really need to be engaged with the people who are fighting in the front lines, because we need all the support possible. So yeah, I think you are gonna be sharing some of the links and things that they can get involved with our work.
Wonderful, thank you. Would anyone else like to add a comment?
This is Karama. I've thought about this in regard to the last question as well, but I do think as a public, to Magali's point earlier about how this is making us all closer, sort of more connected. I think we can all envision ourselves, because we probably all are, trying to self-isolate and not having the ability to do that at work or in your living environment because you're in a nursing home or because you're incarcerated. It personalizes that in some way. And I think as a public, part of what we can do, in addition to what's been said, is really understand what the data is so that we know how to ask questions and we know what to hold people accountable for. So, what are the numbers around who is infected in the number of cases in prisons. What are the numbers? How do we think about numbers in the workplace? How are organizations held accountable for themselves, for subsidiaries, for associated organizations, those kinds of things? Really asking the tough questions. Really read and do the math and really try to dig to understand that so that we can, again, be better positioned to hold others and hold ourselves, frankly, accountable for the world in which we want.
Thank you. Anyone else on that one? Okay. This question was an interesting one. I almost lost it. How do you encourage community engagement when a lot of the community doesn't really trust the government and that their actions will be taken seriously? How do we get over that hump of getting people to galvanize and get behind a movement, but yet there's this trust barrier that we have? Any suggestions on how we might approach that issue?
This is Rich. Fortunately, we have some really good grassroots organizing groups in this state. I think about groups like the Arkansas Public Policy Panel, Arkansas United, the Rural Community Alliance. Whose primary job, quite frankly, is to go out in communities and really try and engage and organize citizens, especially low-income citizens and citizens of color. And so, so to the extent that you have them in your community, or to the extent that you want them in your community, I would reach out to one of those groups. Arkansas Advocates for Children and Families, we don't do grassroots organizing per se, but we do public outreach and engagement. And so oftentimes we will come into communities and do an advocacy training. We will do a policy forum where where we'll have some education sessions around big issues impacting children and families, or we'll come in and do just listening sessions to help inform our own public policy agenda at the state level. So so I would really encourage you to get involved with existing groups that are already involved in advocacy.
The other thing I would just add to that is that, those groups are fantastic. And I would just say, though, if for whatever reason they are not in your community, get in touch with them and see if maybe there's a way to get them engaged in your particular community across our state. And if for whatever reason that's not possible right now, start one of your own. I mean, there are great tools out there for how to do organizing, how to do advocacy. And I think, we don't have to wait on someone else to show us the way. We can lead. I think Margaret said that before. We believe in ourselves in order to create our own solutions. And so I think we can, as a society, as a state, we can do that for ourselves as well.
Thank you. Anyone else on that one? So there's
Karama.
Yes, ma'am.
I'm sorry.
Go ahead.
I was going to say, I fully agree with Karama on that one completely. And oftentimes we don't step out in community and give voice because of fear. And I would say, to the degree that we can, let's try to get over that fear, because if we don't organize and push for solutions at community levels, it won't happen. Unless you make someone pay attention to your community solutions, it's just not going to happen for you.
Great. Thank you very much. Our next question asks about the mental health of our essential workers. So are we aware of any efforts or actions that are being taken specifically to this population, since they are holding it down for us, basically? What are we doing? What kind of attention can we pay to the toll that it's inevitably taking on them? Because we know we're all under this burden, but especially for our essential workers. So, would anybody have anything to share about that?
part of the question.
Sorry. The question was about the mental health of our essential workers, especially since everyone is kind of under this burden. Are we aware of or engaged in any sort of work that kind of helps to undergird and support the mental health of our essential workers as they are helping the economy and the nation move forward?
I don't have a real answer to that, but I would say the fact that there's some level of silence on this call with this panel suggests that there's a real opportunity here, right? And this is the kind of thing where when you hear that silence, the fact that that question was asked, it suggests that somebody in the audience is not aware of what those options may be as well. That's a real opportunity. And, you know, what that looks like now when, you know, maybe you're not going to someone's office, maybe it's a phone call, maybe it's text, maybe it's video chat, maybe there's, you know, what are the ways to make sure that folks have that access? How do we make sure we get it paid for? I think that's a real opportunity to figure that out. I don't have the answers to that, but I think part of what's important about these conversations is not only just sort of providing the answers where we have them, but recognizing where those gaps are and getting invigorated around trying to find solutions for those gaps.
Agreed. Thank you. I agree. I noticed the silence as well because that's a big issue. So we've got about 7 or 8 minutes left. I wanted to provide each of you 1 minute to provide any closing thoughts or final thoughts before we wrap up. Would anyone like to summarize or give some additional things for us to consider? Sharice, I think you may be muted if you're speaking.
Say goodbye since I have to go in a bit. So thank you all. I appreciate the time. Thank you.
Absolutely. We knew that you had to leave, and we appreciate you making time for us. Thank you.
Well, I would just like to add thank you for the opportunity to share the work with you all and to get involved. And I think this is the right time to standing up for these workers, for the most vulnerable communities that are really struggling going through all of this pandemic. So if we really don't stand up for these issues, we are going to be facing a food crisis, a health crisis, and an economic crisis on top of this pandemic. So we really need people to get involved and to fight and resist and to continue until we get a better future for all of these people.
Thank you, Magali. Rich, would you have any?
Yeah, sure. Yeah, last month, Arkansas Advocates released a report on policy changes that the state needs to adopt to respond to the current crisis in a range of areas, including Medicaid, unemployment insurance, SNAP, TANF, early childhood education, K-12 education. We're going to be, and that report is still on our website, and most of it is still valid, even though things are changing weekly in terms of what's going on in terms of state and federal response to the outbreak. But I will say within the next week, we should be putting out an update of that report. And so when we do, we'll publicize that on social media. But I would encourage you to come to our website at aradvocates.org. We also on that website have a COVID response landing page, and we do put out a weekly newsletter where we discuss and highlight the most recent developments on a weekly basis, and so I would encourage you to sign up for that.
Excellent. Thank you very much, Karama.
Yeah, so I'm also grateful to have been involved in this conversation and appreciate everyone's questions and engagement. I think, you know, as we move forward, again, I would sort of go back to something I said earlier and thinking about what you know, in the midst of all of this crisis, and it's been very negative, you know, in so many ways to people I know personally. But I think there are some things that we can learn from this. I think there's some ways we can, and so I think really paying close attention to that. And I would just encourage all of us who are so invested in the future of our state to really look at who is supporting the work that need to have done. So who is providing access to capital for small businesses? Who is providing leadership on policy and grassroots organizing? and support those organizations, get involved with them. If it's a monetary donation, do that. If you want to purchase their products or be their customer, do that. I think those things are really, really important for our state. And lastly, I'll say, I think, we're framing this in the context of coronavirus. I think coronavirus itself has been framed in the context of the 1918 flu pandemic. And, when that happens, we tend to think, okay, well, this is a once every 100-year kind of thing. And what I would argue is that these kinds of situations where there are supply side issues where business is challenged, situations where families are challenged. You just heard from Sharice talking about Alice and how 41% of our Kansans can't meet their basic needs. That was before COVID. These are not new challenges. These are not going away right now. We're going to face challenges again, not just from COVID, but from other kinds of things. So the solutions that we're talking about from COVID are going to be solutions that are going to be effective there as well. So I think it's important, as some of the questioners said, to think about what are the long-term kinds of impacts that we can have to really help us address these problems for the long term.
Absolutely. And you all summed it up really well. I think the question, what have we learned, is really key. Magali stated, justice is not charity. Let's be clear. And we might be able to address some of that charity if we can deal with justice. And then, Karam, I believe you said understand the data so we can ask the right questions. That's really important. And Rich, you said vote. That's the big thing, is making sure that we vote and that our elections matter and they all have consequences, and making sure that we are aware of issue 3. And then, as Sharice mentioned, 41% of our households can't afford basic needs, and that was before COVID. And so the COVID has made Alice more visible. And so this is an opportunity for all of us to get engaged. I'd like to leave you with just one little final note here, that everyday decisions are made that have an impact or an influence on equity. These decisions may include who's hired, what activities take place, which populations are served, and how strategies are implemented and evaluated. Considering how every decision will impact your equity goals and our equity goals is an important step in integrating equity into everyday practice. The key thing to note here is that we have equity goals. This conversation is hopefully getting you in the mindset of equity and what we all can do to set some equity goals for sure. I'd like to take this opportunity to thank my team, Ann Shelley, Ricky Booker, Magdalena Arroyo, and Valerie McClendon, for your help, and of course the support of the Winthrop Rockefeller Foundation. Certainly the expertise and intellect of our panelists today. We thank you very much for giving us your time and energy. And certainly to our participants, thank you very much for your time and attention. And again, we're recording this session, so we will post it to our website. You'll also be able to find it on the social media outlets of our panelists. Please stay safe, stay healthy, and we hope to see you again soon with another really important conversation about our future.